I too want to register my disappointment and my complete annoyance that the Minister has fed the Chamber again. You know yourself from being a member of a smaller group where last and second last groups, it's very annoying when the Minister's always run away. This is a serious issue up and down the country. No respect to you, Minister Feehan, but he just disappeared and he has a good habit of that. Look, this is a hugely annoying situation, a frustrating situation, and above all our people need hope. Hope, and I want to compliment Deputy from Dublin, John Hart, earlier on his powerful speech. People need hope. And the demonising of the students this week in Galway, and the demonising of old people, and the fear that's been peddled and portrayed out there on our team on noon night. I'd love to know what cost for advertising, and what cost for advertising to all the local radios are getting here. And I would be asking questions about that. I think it's shocking. Shocking. And we want people frightened, wearing masks, and scouring in corners and afraid to move. It's shocking. It's the wrong way to deal with it. Have we looked at European best practice on how issues at work in Europe? And I have figures here from the OECD data. Denmark, with a population of 5.8 million, had 27,464 cases, about 33% less than Ireland, with 650 deaths, about 70% less than Ireland. Hungary, with a population of 9.7 million, around twice that of Ireland, had 26,461 cases, about 67% less than Ireland, with deaths of 765, about 80% less than Ireland. Finland, with a population of 5.5 million, had 9,892 cases, over 50% less than Ireland, with deaths of 345, a staggering 80% less than Ireland. Now, there's something wrong here, and is it we are manipulating the figures, and I have evidence of this. That figures have been people have been in touch with me where their loved ones died and they were put down as COVID and they had tests and they were clear. So we need to get honest here and live with the people. And the people of Ireland came up, and the metal spirit and everything they were asked to, all the GA clubs, the community development society, everybody, all different groups, right across the Garda Síochána, the community policing. I want to salute them again in Care and Clonmel and all of Tipperary. They did really, and this is, but there have been mind games being played with the people now, and people are getting fed up with it and are fed up with it, and it's not good enough. As I said, before we stand clapping ourselves in the back for a job well done, we need to have a look at the national, have a national debate on why Ireland has so much higher COVID-19 case rate than 3 countries, for example, as I mentioned. Additionally, and perhaps more alarmingly, it is dramatically higher death rates than Ireland. But we have in Ireland that they have. What can we learn from these comments? Minister, I hope you're listening, and I hope and the Minister has listened. Has the government been in touch with these respective countries to find out how we can improve? Are we just cocooning here and we know best and we do ourselves? We have a bad history in the HSE. Dr. Hooran is coming back, and I hope his wife as well, has a bad history in the HSE with the cervical smear deaths and the death sentences perpetrated on women. We have a great history in a plethora of issues. Look at the waste of the Children's Hospital and the scandals that are there. The scandal I can give them to you that went on here. We need to discuss and scrutinise these numbers. We cannot have a situation where anyone who speaks out or questions the system has been shut up or been sacked from the senior positions, and that's what's happening. One such individual who spoke out recently was Dr. Martin Feely, the former clinical director of the Dublin Midland Hospital Group. He called for a debate and raised some concerns at the imposition of restrictions or the approach being taken several weeks ago. What happened to him? He was fired almost instantly. Well, we know that he was sacked and it's not good enough. We have to ask why. What kind of suppression are we trying to get here? Is it going to be a complete communist state? Because that's the way it's heading. And with sections of the community, the elderly, the publicans, the over 65s didn't get a penny in any payment to over 66s. They'd got nothing. If they're business people or bus drivers or whatever they were, look at our only source of help in here. This is the arts and the creativity and the music industry. They have been blackguarded beyond all, and they're not getting a shilling. And now the banks, the moratorium is lifted from the banks, the bank breaks, and they can mercilessly take their houses, take their vans, take their equipment. That's what's going to happen. So there's something sinister going on here and something rotten in the state of Ireland. Dr Martin Feely has spoken out since an RT1 primetime programme this week, and he called for that we need a full debate on the ongoing strategy and restrictions. I support him in this call, and because I believe in democracy, including the free speech. We're suppressing that too. And I want to quote him. And the cost to the community, financially and socially, is enormous, as we know. And one of the difficulties with this is we cannot measure those costs. We cannot. The International Mental Health Day today, or Suicide Awareness Day. No idea. And why, I want to ask, Minister, I want you to write this down, please. I want answers. Are the figures for self-harm and suicide stopped being collated? I want a specific answer to that, please. You might take interest and take notes. It's been asked here before, and I didn't get an answer. But I can tell you, according to Dr. Feely again, that most people are depressed. Most people are in the country, and the country is depressed. And I'm suggesting this is why I'm asking really that, and I quote him, would like a debate on this. We have no debate, no discourse here. We have no engagement as party leaders' groups. It stopped. It stopped. The cost of this the damage to our children, to our youth, for our mental health people, for everything else is just enormous. And we have to have a meaningful debate and answers to questions. Not a minister who flows out, especially when I'm coming in, because I will ask the questions without fear or favour. So you can come in when I'm finished. The figures. So listen.
Mental health or
the mental of self-harm, self-harm and mental health figures. They stopped being collated since about April, as far as I understand. I want you to refute that and give me the figures. And why are they? Because it's enormous impact. Mention was made by other deputies about the people waiting for cancer smear, bowel screening, indeed, prostate cancer. It's all stacking up. People dying. People are dying from, and the figures were given there, the people that are dying from all the other ailments. 1 every hour for cancer. 27 a day from stroke and heart disease. And no talk about it. And some of these are put down as COVID, so the figures. And why, the last question, my focal score, last count cola. I want to ask you as well, Minister. One day, the figures were corrected from about 1,700 down to there were 500 minus. They were corrected by the HSE. That was the day that Minister, the Taoiseach at the time, Varadkar, was after being out sunning himself in the park the day before. That has never been. The figures are back up again, and the figures are not true that have been peddled on RT and everything else, and they should be corrected. Why perpetrate untruths and lies to spread the fear?
Thank you.
Thank you.